Hello, my name is Dr. Tahir Akhtar and I'm a clinical director in critical care medicine. Today I will be talking to you about admission criteria for COVID-19 patients into the intensive care unit. That is, which patient would require intensive care unit and will benefit from that admission. As you know, that most patients with COVID-19 will have very mild symptoms, or they may even be asymptomatic. There are about 15% of the patient that will have severe COVID disease, and some of them will require hospitalization. And there are further 5% that will have shortness of breath and severe respiratory distress that they will require admission into an intensive care unit and mechanical ventilation. To evaluate a patient's likelihood to benefit from admission into an intensive care unit, it really is at the discretion of the admitting physician, and they'll consider all aspects of the patient condition before they will decide whether to admit the patient or not. However, there are certain decision-making support tools that can be deployed, but this is only a part of the overall decision-making process. So to start the process, first of all, calculate the patient's clinical frailty score. The clinical frailty score, it consists of 9 scales, from the first scale, which is very fit and healthy person, to scale 9, which is terminally ill patient. But in most cases, it is the patients at frailty score of 5 that will determine whether the patient is likely to do well or not when they need an intensive care facility. So once the frailty score is calculated, then you should look at the comorbidities of these patients. Severe comorbidities like severe COPD, congestive cardiac failure, hypertension, diabetes, cirrhosis of the liver with portal hypertension, end-stage kidney or metastatic disease will all affect the outcome of these patients with COVID disease. If the frailty score is more than 5 and the patient has significant comorbidities, patient is likely to have poor outcome and will not benefit from admissions into an intensive care bed. Recent ICNARC data, it shows that the patients that were of age more than 65, particularly with increasing age, there is higher mortality. Similarly, the patients that have other comorbidities, there is higher mortality in these patients if they require intensive care admission post-COVID infection. Intensive care beds, they are a finite resource, and only patients that are likely to benefit from these admissions should be considered for intensive care treatment. If there is doubt or if the decision is not clear, then three wise men approach should be applied. That is, the three wise men will be a consultant intensivist, a consultant respiratory physician, and a specialty consultant. And an overall review of the patient should then determine whether they are appropriate to have intensive care treatment or not. Once decision is made, a clear DNA CPR decision and treatment escalation plan should be documented in the patient's notes, and their unsuitability for intensive care admission should be communicated both to the patient and to the relatives with utmost care and sympathy, understanding that this is a very difficult decision. Thank you for listening.